After safety review, federal health agencies lifted the 11-day pause on the use of Johnson & Johnson COVID vaccine on Friday, April the 23rd, 2021. Early in April, the CDC recommended a pause in the use of the J&J vaccine due to the discovery of 6 cases of a rare blood clot among its 6.8 million recipients. After thorough review, CDC has found that among nearly 8 million people who got the J&J vaccine, 15 recipients developed a rare blood clotting condition called thrombosis with thrombocytopenia syndrome, or TDS, and 3 of those recipients died. TDS is a medical condition in which abnormal blood clotting occurs in the presence of thrombocytopenia or low platelet count. A platelet is a type of blood cell that helps form blood clots to stop bleeding. When blood vessels are broken, platelets are activated and secrete vasoconstrictors such as thromboxane A2 and serotonin, which cause spasms in the broken blood vessels. The activated platelets also aggregate together to form temporary platelet plugs to stop bleeding and secrete clotting factors to enhance blood clotting. The CDC has found that all of the 15 blood clotting cases were women. No cases were seen among men. 13 were in women aged 18 to 49 years, making the blood clot rate in this group of people approximately 7 cases per million. Among women over 50, the rate is 0.9 cases per million. While the overall rate of TTS was 1.9 cases per million among J&J vaccine recipients, the highest risk was among women ages 30 to 39 who have a rate of 11.8 per million. It is worthwhile to mention that 12 out of the 15 blood clotting cases developed blood clots in the brain called cerebral venous sinus thrombosis in the presence of thrombocytopenia or low platelets. The cerebral venous sinuses are a group of sinuses or blood channels that drain venous blood from the brain to the heart. The other 3 women had blood clots in other parts of their bodies. Blood clots are not uncommon, but TTS is extremely rare. It involves pathogenic antibodies called anti-platelet factor 4 antibodies. Antibodies likely activate the platelets and the endothelium, which is the lining of blood vessels, leading to blood clots and a low platelet count. A recent article published in New England Journal of Medicine demonstrated that testing for antibodies to platelet factor 4 was positive in 22 out of 23 patients with TTS after they received AstraZeneca COVID vaccine. This vaccine is similar to J&J vaccine in that both utilize adenoviral vectors to deliver the DNA encoding the COVID spike protein. It is now believed the benefits of single-dose J&J vaccine outweigh the rare risk of blood clot. The CDC and the FDA stated on Friday that the chances of developing severe blood clots and low platelets after receiving the J&J vaccine are very low. The federal health agencies recommended resume the J&J vaccine use in all adults over the age of 18. Studies have demonstrated that the Johnson & Johnson COVID vaccine is safe, effective, and convenient. It requires only 1 shot. However, women under the age of 50 should be aware of the risk of the rare blood clotting syndrome associated with the vaccine. While I am making this video, 2 additional cases of TTS, including a man and a woman, were reported, putting the total number of TTS to 17 out of nearly 8 million J&J recipients. I would like to mention that there are many risk factors for blood clots. Prolonged sitting, long-distance travel in an airplane, a train, or a car, prolonged bed rest, for example, due to surgery or illness, pregnancy, smoking, obesity, birth control pills or hormone replacement therapy, certain cancers, etc. As with other COVID-19 vaccines, people who receive the Johnson & Johnson vaccine can experience some side effects in the first 3 to 5 days after the shot, and these symptoms should resolve within a few days. If you develop the following symptoms 5 days to 2 weeks after receiving the Johnson & Johnson vaccine, you should contact your physician immediately for evaluation of possible blood clots. Severe headache, sudden chest pain, sudden leg or arm pain, swelling in the leg or arm, rapid heart rate, shortness of breath, sweating or fever, coughing up blood, a full body rash, abdominal pain, a feeling of overwhelming dread or doom. It is important to remember that we are still in the middle of the COVID-19 pandemic. Without COVID vaccination, the risks of getting COVID infection is quite high. In fact, the COVID-19 infection carries a much higher risk of blood clots. Studies have demonstrated that about 1 out of 7 hospitalized COVID-19 patients experience some type of blood clot. A recent cohort study of 13,500 hospitalized COVID patients between March the 1st and May the 30th, 2020, showed that 12 patients had cerebral venous thrombosis with an incidence of 8.8 per 10,000, though it was not known whether these patients also had low platelets. Regardless, the incidence is much higher than that of cerebral venous thrombosis in the general population, which is 5 per million annually. If you still have concerns about the rare risk of blood clot associated with the Johnson & Johnson COVID vaccine, you may consider getting the mRNA COVID vaccines from Pfizer or Moderna. So far, there is no report of TTS from getting these two mRNA vaccines. In summary, the Johnson & Johnson COVID-19 vaccine is considered safe, although there is a very rare risk of thrombosis with thrombocytopenia syndrome among women younger than the age of 50. The benefits from the Johnson & Johnson vaccine shot outweigh the risk of blood clot. However, if you develop severe headache, chest pain, trouble breathing, extremity pain, etc. 5 days to 2 weeks after receiving the J&J vaccine, you should contact your physician as soon as possible.